We're joined on the line by Representative Dan Crenshaw, representative for Texas's 2nd Congressional District and host of the podcast Hold These Truths. He's author of the brand new book, Fortitude, American Resilience in the Era of Outrage. It is available everywhere. The book is terrific. Dan, great to talk to you, sir, and congratulations on an excellent sparring with Bill Maher the other night.
Great to be with you, Ben. I appreciate it. You know, I learned my sparring from you.
Oh, well, that's a kind thing to say. Well, but you've always been a better fighter. Now I just need to work out regimen because I'm lacking as that. There's a video of the two of us arm wrestling, and Dan is
just lift more weight.
Yeah, Dan engages in a sort of compassionate end of life care with me during that arm wrestling session. He lets me last for a solid 0.7 seconds before putting me away. So Dan, why don't you recap for our listeners what exactly happened with Bill Maher? I mean, for those who missed it, Dan was on Bill Maher's show, and Bill Maher basically started in with the usual litany of here's all the ways President Trump failed and he should have acted sooner, and Dan basically just laid out the timeline. Why don't you lay out that timeline now for folks who missed it?
Yeah, well, there's a lot to it, and we have to debunk this narrative. Not because it's important to defend the president. It's because it's important to defend the truth here, and it's important to analyze people's decisions in the context of the facts that they have at the time. And over the last week, I've just been trying to lay that out through my podcast, through videos we put out, which the president was very excited about. He shared that video on his own Twitter recently. There's a number of facts that we have to put into context. It's not to say that the administration has done perfectly or that they were perfectly prepared. It's not the argument I'm making. I don't think it's possible to be perfectly prepared in the face of a pandemic like this. I think we're all doing the best that we can. And so one question I ask people is, if you're going to criticize these decisions or the processes that the government has made, where is the fork in the road? Where is the decision point that you think so obviously should have been made differently? You know, and they won't be able to answer that. Actually, they will. There's one case where they'll be able to answer that, which is on January 31st, when President Trump put in pretty draconian measures to restrict travel from China. And now they decry that as ineffective because people still got in. Well, they were U.S. citizens and passport holders, and I point that out to them. And so I asked Bill Maher, are you saying that back then you would have actually said no U.S. citizens could be repatriated? Is that your argument? I mean, I hope not, because that would be pretty heartless to our own citizens. And so, but we also know that on that same day, Nancy Pelosi, and nobody knows this, but on that same day, Nancy Pelosi proposed the No Ban Act. The No Ban Act, what would that do? It would actually prevent President Trump from taking on those kind of measures that he did to restrict travel. So we know for a fact that a Biden administration or if Pelosi was in charge, they would not have done that travel restriction. That's a pretty big deal, and they're trying to downplay that in the media a lot, but it's a huge deal. They also talk about the lost month of February. Now, this is an easy talking point because there was no big, grand action like a travel restriction or 15 days to slow the spread that happened in March. There wasn't some big action that took place in February. But the question then, is that all that surprising? Because the reality is we didn't have hardly any cases. By March 2nd, we only had 102 cases in the United States. The pandemic hadn't really taken off in Italy or Spain yet, and they wouldn't lock down until mid-March. Let's not forget that. So context is important here. Also, it's just not true that we weren't doing anything in February. I mean, this was when public-private partnerships were occurring to get vaccines done, to get testing done. Now, none of it happened as fast as we would like, and in hindsight, there's plenty of things we could have done differently, like not have stringent FDA regulations during a pandemic. But those regulations had long been in place, and they did prevent the private sector from creating tests faster. Also, it's not as if there was a magic button that we could just press for more PPE or less PPE. The reality is that China had long been limiting their exports because a lot of it gets manufactured there, and there's a global supply shortage. So again, it's not making excuses, but it is explaining to people why things are the way they are, and to lay blame at just President Trump's feet and to say it's blood on his hands is so over-the-top absurd and flies in the face of the evidence that we have and the timelines that we have.
So, Dan, meanwhile, obviously there's been a lot of controversy that's broken out across the country about reopening and when Americans should reopen. It seems to me that this is broken down in the stupidest possible way, as per our usual conversations. On the one hand, you have people a very small fringe of people who are saying, well, just reopen everything, no masks, no social distancing, just embrace the suck, just go for it, man. And I think that's like 7 people, and I think the media are taking those people and blowing them way out of proportion. And then there are people who take advantage of that on the other side, and then they say, well, this means that as long as there are nuts out there like this, we have to continue to lock this thing down forever. It seems like, honestly, the only way out here is going to be that younger, healthier people are going to put on masks. They're going to socially distance. They're going to go back to work. If you are older, if you have pre-existing conditions, you're going to stay home. You're going to socially distance from the younger people. And eventually that's how things are going to be until we come up with better treatments or with vaccine.
Right. And if we did away with the political opportunism and we just had, I think fair-minded people sit in a room and think in a common sense way about what the new future looks like, it would sound exactly like what you're describing. Every business would have a new normal. I think mask wearing is a new normal for a pretty long period of time. I don't think anybody is shaking hands for a pretty long period of time. It's not back to normalcy. It's back to a new normalcy where we can live side by side with a risk, but also open up the economy. And I firmly believe we can do that. And this shouldn't be all that controversial. But I did anticipate the bad faith arguments. I wrote about this in an op-ed in The Hill a couple weeks ago, where I noted that the real pandemic, there's 2 pandemics that are spreading across America. One is the bad faith of political opportunism. The other is COVID-19. And that bad faith opportunism sounds something like this. Well, let me just ask you a question. How many lives is it worth to save one job?
Right.
And that's a really disingenuous, bad faith way to ask that question. We can't, it's not a binary choice of keeping everybody shut in indefinitely and then just letting people die. Like we have to learn how to mitigate the risk. We are doing that. We're mobilizing and transitioning to a new normal where we increase our testing capacity. But most of all, we engage in a sense of personal responsibility. It's important to tell people, like, you can prevent yourself from getting this. Like, there are certain measures you can take to prevent you from getting this while also getting back to a sense of normalcy. And we have to allow people to take that control over their lives and trust the American people a little bit to do the right thing, because I think the public's well educated on the measures that need to be taken.
So, Dan, on a federal level, there's been a lot of talk about what Congress can do right now to fill back in, for example, the small business fund. The Democrats have been holding that up for no reason that I can discern. What is the status on that? Is that going to pass this week? And how exactly, why exactly are Democrats holding this thing up? I mean, it's pretty obvious that this fund needs to be replenished at this point.
It's infuriating because they're virtue signalers, first and foremost. And they're playing the same kind of games that they've always played, but they fail to realize that we're in a crisis and they can't play those kind of games. So what they'll claim is that, fine, we'll refund the PPP program, but we also need more funding for hospitals. And so last week we were thinking, well, that money that we've already designated for hospitals and for testing, for all of these things, that's not even close to running out of money yet. But the PPP program is running out of money right now. Why can't you guys just agree to that? And so now we've waited an entire week to do that. So I think there will be a deal, and it will look like refunding the PPP program pretty generously, which is necessary, and then also adding more money for hospitals and testing. Again, we never had a problem with this, so this is why this is so infuriating. We never had a problem with that. It just wasn't urgent last week. It's not even urgent now. It might need to be refunded, so fine, I'm happy to do it now. But there was no reason to wait an entire week. No reason at all. People have to know this. The media lets the Democrats get away with this. They've gotten away with it 3 different times, by the way. The first time was back in February. Again, the supposed lost month of February. Let me remind everybody, the administration asked for $2.5 billion to fight the pandemic back on February 24th. The Democrats put anything on the floor? No. Not even in a few days did they put something on the floor. The only bill they put on the floor that week was to ban flavored tobacco. It would be another week before we actually voted on any money. Happened again during the rescue package, which everybody remembers when Nancy Pelosi wanted like 15 crazy progressive items added to the list. And eventually we got down to a bill that looked basically the same as what had already been negotiated, but unnecessarily delayed. They're doing the exact same thing again. And they get away with it time and time again. Nancy Pelosi can go on TV and show everybody her bazillion-dollar fridge and ice cream and just gets away with it. And then the polling suggests this. The polling shows that the Democrats are getting away with this. I mean, so it's really just up to people like us to get the truth out there.
Okay, so Dan, speaking of sort of when you think that various states are going to reopen, obviously Texas never really closed down all the way. Governor Abbott has already spelled out some ways in which Texas will reopen, hopefully in the near future. What do you think the timeline looks like for states like Texas in terms of getting to this new normal?
Well, by next week, we'll be opening retail, but in sort of a takeout fashion. So a lot of retailers will still be open as they are now. It's what's considered the essential industries, but that's still things like Target, Walmart, Lowe's, Home Depot. But more retail will be allowed open in the future, but it'll be like takeout retail. And then we'll continue to expand on that. We've also allowed much more medical procedures to take place, which is a very good thing because we're having a dearth of medical procedures, and that's building up, and also people aren't getting the health care that they need. So we're opening that up as well. And I think that stage transition will continue. The important thing to remind people of is that focusing just on the peak, which too many policymakers, I think, talk about this. Like, well, we haven't hit the peak yet. Well, okay. First of all, you have to look at the absolute value under that peak and then compare that to your actual health care capacity. People are forgetting that part of it. People are also forgetting that you won't really know you hit a peak until weeks later. So you can't really look into the future and say, hey, guys, today was the peak. I mean, you can't say that. So it's not a useful tool it's not the only tool, let's say, to drive public policy. And I worry that too many states are thinking about it that way, with this huge abundance of caution without thinking of the consequences of that caution and without comparing their own actual numbers to their own healthcare capacity. Again, New York City should be making very different policies than Houston. Another little thought experiment I point out to people, if we're so worried about the peak, let's do this. Let's do a little thought experiment. Take the numbers out of Houston, which are very low cases. We've had around low 30s in total deaths in the fourth largest city in America. If you took our numbers and you replaced the word Houston with New York City, you'd get two very different policy outcomes. New York City would think, oh my God, we're well on our way out of this. We should open up. We're doing great. But in Houston, we're still locked down. So that simple thought experiment shows you the problem with only focusing on a peak and the curve, that there's other data that we have to be thinking about as we make these decisions.
Well, Dan, great to talk to you. It's Representative Dan Crenshaw, representative for Texas' 2nd Congressional District. Go check out his book, Fortitude, American Resilience in the Era of Outrage, and also his podcast, Hold These Truths. Dan, appreciate it. Talk to you soon.
It was great talking to you, Ben. Thanks.
I hope you enjoyed that clip from The Ben Shapiro Show. If you did, go ahead and hit the subscribe button so you stay up to date on all of our future content.